Hello everyone. Today's video is another Q&A video talking today about uh, addressing yeast issues when someone needs to be on antibiotics, talking about herbs for large intestine bacterial overgrowth, and then also discussing why a person might have a lot of dyspepsia / gas overproduction even though they've completed their triple therapy for H. pylori. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the first question here is, how would you help a patient that needs to be on antibiotics but has a Candida overgrowth? Is it generally okay to stop the antibiotics and fix the gut? Also, is administration of antifungal medication safe alongside antibiotics? So good questions. In terms of like antifungals alongside antibiotics, really depends on the specific drugs. Some of them are absolutely compatible to work with at the same time, just depends on the drug. Also depends on the overall state of health of the patient. You know, do they have liver disease? Do they have kidney disease? Are there some concomitant comorbidities that might be going on? So, but generally speaking, there are plenty of patients that I've worked with who have been on antifungal pharmaceuticals and antibiotics. And then of course, there's also depending on the case, the option of using non-pharmaceutical treatment for one or the other condition, depending on what you're actually dealing with, which sometimes if there's an interaction or a contraindication to have this pharmaceutical with that one, maybe there's a non-pharmaceutical alternative that could be used instead that wouldn't interact. So if a patient has a yeast overgrowth, Candida overgrowth, and they need to go on antibiotics, it really depends on what they need to go on antibiotics for. If someone has like a pneumonia and they're just, they're going downhill, it's like, well, probably lesser, I'm not giving any advice here, but generally speaking, my rationale would be like, well, probably lesser of two evils to risk a flare of Candida and not potentially have some serious respiratory complications. Whereas if someone says like, oh, I've been suffering with chronic symptoms for many years, I have yeast overgrowth, and like I was just diagnosed with Lyme, and my doctor wants to put me on a bunch of antibiotics, like what should I do? And I'm going to be on antibiotics for like the next 3+ months, maybe 2 years. It's like, well, that's maybe a different kettle of fish. So it really depends on the context, but in my experience, I would say very extensive experience, I've had many patients who are on antibiotics while working with me. Going on a really good potency probiotic tends to really mitigate the gastrointestinal side effects, the yeast overgrowth side effects, the potential thrush side effects of going on an antibiotic. So by and large, when patients come to see me and they say like, I'm really sensitive to drugs, I've reacted to antibiotics before, I've had yeast overgrowth issues, I get yeast infections every time I go on an antibiotic, I would say with like a good, I'm estimating here, but I would say like a good 95% efficacy. I find that going on a really good potency probiotic is usually 95% of the time effective at mitigating any side effects from that antibiotic. So that's been my experience, and it's a pretty darn good track record, I would say. It might even be higher than 95%. Like I'm hard pressed to think of a case where it didn't work, but there's probably been some. I've been practicing for 16 years, so I might have missed something, forgetting a case. But generally speaking, usually works really well. Now, if a patient's going to be on antibiotics for many months, many years, that might be that's maybe a different kettle of fish. There might be maybe the track record's not quite that good, but still pretty good, I would say, based on my experience. So yeah, high potency probiotic, and not giving any advice here, but I have no financial ties to this, but a really good product that I like in my practice is called Multistrain 50. It's made by a company called Cytomatrix, and I really like it. It's got a good price points, really good blend of probiotic strains. As much as I like that product, it's definitely, to my understanding, my opinion, it's not that it's like super unique and it's like this extra special probiotic that's not just as good as other good probiotics from other companies. I just like them for they're good company, it's a good price point, good dosage. So that's kind of like my template for how I base my probiotic prescribing for folks who are needing to mitigate side effects from or worried about side effects from going on antibiotics. Let's see here. Did I cover all of that? Okay, I hope I covered all that. If I missed something, just post another question. I'll do my best to answer. Next one here is, So I had a video all about large intestine bacterial overgrowth, also known as LIBO, and the person posted here saying, you mentioned dry herbs for treatment, but didn't mention any ones besides wormwood or black walnut. So I don't remember what I said in that video. I posted a lot of videos, but some of my go-tos for LIBO, and as mentioned here, that mentioning dried herbs. So what I would have probably emphasized in that video is that when I have patients who are dealing with what appears to be LIBO, or what we have lab evidence indicating a LIBO issue, is I find that dried herbs seem to work quite a lot better than tinctures and essential oils. And I think the reason being is that, to my understanding, tinctures and essential oils are much more prone to systemic absorption, which is awesome when we're dealing with systemic infections like Lyme or chronic viral infections or different co-infections or things like that. But when we want the herbs to stay in the gut, my understanding and my belief around it is that dried herbs are going to stay in the gut for longer. If you think about, if you were to take, say, a capsule of dried herbs, open it up and put it in some water, like it's going to kind of be like this herbal sludge. It's kind of like there's a lot of fiber in there, and a lot of the constituents in the herb, I think, are embedded in that fibrous material itself. And so my belief, based on what I've seen clinically and what makes sense, pharmacokinetically, is that those constituents should travel from the top end to the bottom end of the intestinal tract, which, of course, when we're treating the large intestine, we want those herbs to stay in the gut all the way down to the end of the intestinal tract. So yeah, some of my go-to herbs include black walnut and wormwood, as mentioned, also grapefruit seed extract. And then those are like my go-tos for most patients. That we use this formula called dysbiosis formula, made by a company called Signature Supplements. I have no financial involvement in them either, and it's just equal parts of those herbs, and that's kind of my go-to formula. But some cases don't fully respond to dysbiosis formula, so sometimes we'll use dried oregano, we'll use dried thyme, we'll use dried cloves. Pau d'arco would be a good option. Pomegranate seed and rind, i.e. the gross tasting parts of a pomegranate, that would likely work well too. So like those are some other options. So more than two. There could be other herbs that would work well too, but that would be kind of the top ones on my list. The last one here, there's a video that I posted about H. pylori, and so the question here is, why am I so gassy and have flatulence rather after a meal? I have completed triple therapy presumably for H. pylori, because that's what people use triple therapy for. So in a case like that, if I was to see a patient like that in my practice, I would be thinking that either the triple therapy didn't work, and maybe there is still H. pylori afoot, or the patient might have another issue. They might have SIBO, they might have LIBO, they might have yeast overgrowth, they might have some exocrine pancreatic insufficiency, they might be eating foods that they just are not good at digesting. So it would really depend on the timeline and different things like that. But and then it would also depend on whether there was like any change at all with the triple therapy, or if everything's just as bad. Did they have stomach pain before the triple therapy, and then after the triple therapy the stomach pain went away, but now they're gassy and flatulent, suggesting maybe the antibiotics decimated their healthy gut microbiome. So there's few possibilities there. So but generally speaking, if I saw this in one of my patients, I'd be thinking like there's probably something else going on over and above H. pylori, which certainly can cause gassiness/flatulence, but more commonly that would be more of a hallmark symptom of something like SIBO or LIBO or yeast overgrowth, or EPI, exocrine pancreatic insufficiency. So anyways, any further clarification needed on that, just post in the comment section. I'll do my best to answer as soon as I can. I'm going to leave it there for now. Any questions, you know where to post them, and if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I would really appreciate it. So thanks in advance for taking a second to do that.